Here's how to never catch COVID-19. Even though some government officials stated that summer would be the end of the coronavirus, that turned out to be more wishful thinking than anything else. We only barely managed to beat the curve before the onset of the second wave caused by the relaxation of lockdown measures. Today, we have to be just as careful to avoid becoming a statistic as we did back in March. So in this video, we bring you the doctor's top 11 most effective recommendations to avoid catching COVID-19 this summer. You'll learn what you should and shouldn't do, but most importantly, how to keep your family safe while still being able to enjoy the bare minimum of summer activities. Before we begin, please remember to subscribe to our channel, hit the like button, and tick the notifications bell to get the latest updates on the coronavirus pandemic. Number 11, go swimming this summer. If there's one thing that makes a long, hot summer great, it's going to the pool with friends. And the first question a lot of doctors are being asked is it safe for my kids to go swimming? The answer, unfortunately, is not yes. But it isn't no either, because it depends. Scientists know that the chlorine in pools is very effective at destroying the virus, so it will be perfectly safe for your kids to swim in adequately treated pools, without you having to worry about who's swimming there before. However, even in the chlorinated water, we still have to keep social distancing from each other because nothing stops virus-soaked water droplets from reaching our eyes, mouths, and noses if we get too close to someone who is infected. The first thing to do would be to avoid public pools and to make sure that there are only a few people at a time both in and out of the water. Number 10, visiting friends. Yes, we all love visiting our friends during the summer, or having them over at our house. But since we have no control over our friends' social life, and we can't be sure where they've been, and we have no idea who they come in contact with, even something as harmless as a 15-minute gathering for a cup of coffee can mean the spread of a disease to you and your loved ones, especially considering how contagious infected people can be even without any symptoms. It is therefore better to avoid both visiting friends and having them over at your house. Remember, stick together, but at a distance. Number 9, be assertive. Imagine you're standing in a line. You get a little too close to the man in front of you, and he starts yelling at you to back off, accusing you of trying to infect him and his family and so on. How would that make you feel? If you can get angry as well, things could get really ugly. Asking someone to keep their distance can be a bit awkward at times, especially when it's someone you know, and particularly if they try to greet you with a kiss or a hug. In these situations, it's very important to be as polite as possible while making sure not to compromise your own safety. Number 8, keep moving. Recent studies suggest that short interactions with infected people don't usually end in contagion, but it takes about 15 minutes of close interaction for us to catch it. The same studies also suggest that risk of contagion can also be minimized if we interact or talk while walking, running, or riding a bike instead of while standing or sitting still. So, if you want to catch up on gossip this summer, invite a friend to go jog on a solitary path, talk while you walk, and don't stop moving. Number 2 on the countdown is closely related to keep moving, and there's an honorary mention of a myth debunked just before we get to number 1. For now, let's go on to the next one. Number 7, the person behind you should keep a 6 feet distance from you. By keeping 6 feet apart from each other at all times, we minimize the risk of coming into contact with potentially hazardous water droplets coming from others when we speak, cough, sneeze, and especially if they're not wearing a mask. Give the example and make sure to always keep your distance from those in front of you, and politely ask those behind you to keep their distance as well. Number 6, avoid skins, lips, hugs, and kisses. It should be obvious by now why hugs and kisses can be dangerous. You can't hug someone while keeping 6 feet apart, let alone kiss them. And kissing also puts our lips in direct contact with the other person's skin, directly transferring any virus particles from one to another. If you want to show your love to someone else this summer, do so by touching your elbows or come up with creative greetings akin to dance moves touching each other's feet. This proves you love them enough to care for their safety and their health, while a kiss during this pandemic does the complete opposite. Number 5. Plan ahead. We should do all we can to minimize the number of times we need to go out of the house. But if we do have to go out, it's important to plan our route and carefully make the trip as quick as possible to avoid crowded places. If you want to get together with some friends, plan everything out of a small group. Prepare any food or drink ahead of time, and plan activities that can be done while keeping safe distance. When you plan your adventures into the outer world, make sure to avoid having to go to the other enclosed locations. Next two on the list are extremely important and are the easiest to do and 100% within your control. Yet, over half of American adults still don't do them. Number 4. Washing your hands frequently is still essential. Doctors can't stress enough how important hygiene is to control outbreaks and any infectious diseases. We use our hands every day to interact with the world around us, frequently touching different surfaces, doorknobs, remote controls, and whatnot. It's also very common for us to touch our faces as well. Since the coronavirus is transmitted when it comes into contact with our eyes, mouth, or nose, our hands become the perfect vehicle to transport the disease from different surfaces to our bodies. To say that we can avoid this by touching nothing is unrealistic. So what we must do is instead wash our hands as frequently as possible and use hand sanitizer whenever we don't have access to soap and water. Number 3. Wear a mask. Unless there's someone sick inside your house, it isn't necessary for you to wear a mask while inside. And it isn't necessary either if you're walking around on a lonely park or beach or any other open space. However, whenever you leave your house and there are other people around, you should always wear a face mask, not only for your own protection, but also for the protection of others, since you could have the virus and not know it. This is especially the case when using public transportation or whenever entering an enclosed venue where there are others around. If you plan on going to the pharmacy, or worse, to any healthcare facility, it's also essential to wear gloves and, if possible, a face screen. Number 2. If you must leave your home, stay outdoors. Staying at home whenever possible is, by far, the best way to avoid unnecessary exposure to the virus. It's an environment we control and keep as clean and disinfected as we see fit. But once outside your house, the second safest place is to be outdoors. The worst you can do is go into another enclosed building that might not keep the same sanitary measures you keep at home, and where it will be very difficult to keep a safe social distance from others. This implies that you should do your best to avoid visiting other people's houses, even if they are friends and family. We've covered 10 of the most important recommendations to avoid the coronavirus, and we're down to number 1, which is almost unavoidable. Before we reveal number 1, there's an honorary mention to debunk the myth. Honorary mention: takeout delivery food. Before moving on to the final item on our list, we would like to mention that, even though many studies have already been conducted, there is absolutely no evidence to suggest that ordering takeout increases the risk of contacting COVID-19 in any way. So if you're craving a Friday pizza night this week, go for it. Just make sure to use contactless payment just in case. And now, without further ado, the number 1 doctor's recommendation to avoid contracting COVID-19. Number 1. Avoid public bathrooms. One of the riskiest things you'll ever do, besides kissing them on the mouth, is using an infected patient's bathroom. Researchers find that patients actively shed virus particles not only through water droplets coming from their mouth, but also in their feces, even if they don't show symptoms of diarrhea. As a consequence, most parts of a bathroom can easily become contaminated with the virus and potentially spread it to us if we use it. This is because when we flush the toilet, an aerosol of water can form on top of the plume that can transport the virus up to 3 feet up into the air. It was also proven that the coronavirus can survive up to 3 days when splashed onto plastic surfaces, such as toilet seats. Since we can never know who used the public bathroom, avoiding using them altogether is one of the best ways to stay healthy. If nature calls and you absolutely gotta go, then use gloves, disposable sanitizing wipes to clean the toilet seat. Be careful to flush only once you're ready to leave, and wash your hands thoroughly afterwards. Which of these recommendations are you already implementing in your daily routine, and which are new to you? Leave a comment and join the discussion down below. That's it for this video, where we brought you the top 11 recommendations from doctors on how to never catch COVID-19 this summer. Thanks for watching.